And then you got a pointer. So you're going to have a normally positioned arytenoids right here on the top. Then you got the vocal cords right there. You got the epiglottis. You have the epiglottic folds on the side, and then you have the palate on the bottom. Normal position. During swallowing, what is going to happen is the epiglottis is going to fold up, close the glottis, close the arytenoids, push up, and everything goes to the esophagus. So during occlusion, the demand of air is going to be more, so those arytenoids are going to open, just trying to get air in. And during exercise, those arytenoids that you can see are constantly open. And they maintain open for a certain period of time, and then close, open and close. So you have to have, it's a must that these two guys work fine. If the left or the right arytenoid are not providing the normal function, it's going to be a problem for this athlete. Makes sense? For other horses, might not be a problem. Horses who perform at high speed will have a problem. You need the air. Make sense? When you're doing an endoscopy of the guttural pouches, it's very important that you evaluate both sides, both guttural pouches, left and right. You have to examine the medial and the lateral compartment of each guttural pouch, because different things live in different compartments. Different disease process will happen in different compartments. So you have to know what you're looking at. Let me repeat that. You have to know what you're looking at. Make sense? So inflammation of the guttural pouches will cause an incredible array of clinical signs, from just a Horner syndrome, for instance. Could be a sequela from the guttural pouch problem. You're going to have fracture of the stylohyoid bone. You can have mycosis of the guttural pouches. You can have chondroids. You can have empyema. You can have tympany, on and on and on. All right? When you examine the nasal passages, this is another very important part. You have to, it all depends how you're used to do the show. If you want to examine the larynx first and the pharynx, you can do that. But you're going to have to examine the nasal passages on your way out. The way I do mine, I like to examine the nasal passages on the way in, get to the larynx, the pharynx, look at the guttural pouches. If I need to get in there, I will get in there. If not, I come back and look at the nasal passages again. You can miss things. You have to look very closely. Must evaluate each nasal passage individually, left and right nasal passages, because they have the same things on one side and the other. We got two of them, so you have to look for this shit. Make sense? Look for masses. Masses are very important on the upper airway of the horse, especially on the sinus system. This is exhausting. So you have to look very close for masses on the upper airway, especially on the sinus, the frontal sinus, the rostral-maxillary sinus, the cavo-maxillary sinus, the ventral-conchal sinus, the dorsal-conchal sinus. You have to look for everything that needs to be looked at. Right there on that picture, you got a very good picture on the top of the ethmoid labyrinth or the ethmoid sinus. This is part of a sinus. So you have to look there for hematomas, ethmoid hematomas. You have to look for discharge from the sinus, where it's coming from, which sinus, the nasomaxillary opening, which other sinus. And I'm going to tell you that whenever we get to the anatomy of the sinus, that I'm going to blow your mind as much as how little we know, you will understand. It is such a complicated structure as far as what goes where, whence go what, and it's just a very complicated structure. So you have to have a strong anatomy knowledge when you're dealing with the sinus system. So obviously we're not going to get that complicated, because that will escape the scope of this particular class. But if you're going to do horses for a living, especially if you're thinking about being a surgeon,